Well, good afternoon, ladies and gentlemen, and the very warmest welcome possible from myself. I'm David Livermore, Professor of Medical Microbiology at the University of East Anglia, and my co-chair, Maria Virginia Villegas of the Universidad El Bosque, Cali in Colombia, to this symposium sponsored by Accelerate Diagnostics on bacteremia diagnostics in a brave new viral world, clinical microbiology and patient management considerations. I hardly need say, ladies and gentlemen, that it's been a remarkable 18 months for infectious disease. The world has been turned upside down by this viral pandemic. Hopefully, through vaccines, we are now starting to get on top of it. And as that happens, the old world is going to re-emerge. And that old world is one containing antibiotic resistance and the challenges of resistant pathogens, of swiftly recognizing them and selecting an antibiotic for the patient. How much, though, will that world of antibiotic resistance have been changed by the things that, rightly or wrongly, we've done during the pandemic? We know that intensive care units have been under extreme pressure, and perhaps antibiotic stewardship within those ICUs has slipped, selecting for more resistance. On the other hand, travel and the international transmission of resistant bacteria has surely been reduced. Tremendous travel restrictions continue to apply. That's why we're not all sitting round a restaurant table tonight in Vienna. On top of that, antibiotic use in many countries has been reduced, and sadly, people have been dying at home when they ordinarily would have been admitted to hospital where they might have got antibiotics. So, in Spain, for example, antibiotic use down by about 2%. In my own country, down about 14%. Has that reduced selection of resistance and indeed resistance prevalence? We're going to have, I'm sure, an absolutely fascinating symposium. We have 4 excellent speakers. Firstly, Professor Laurent Pourel, who's going to talk about global resistance threats and trends, the epidemiology of resistance. Then 2 speakers, Dr. Romney Humphreys of Vanderbilt Medical Center in the US, talking about how you measure success in detection and recognition of resistance, the hows and whys of integrating rapid diagnostics. Thirdly, continuing with that same theme, Dr. Catarina Chavez of Coimbra Hospital and University Centre in Portugal, who's going to talk about the rapid phenotypic susceptibility testing and the pragmatics of laboratory implementation of those rapid tests. And finally, on the epidemic within the viral pandemic, keeping our eyes on the ball, Professor Michael Osterholm of the University of Minnesota Medical School in the United States. I'll say a few more words about each of the presenters as we come to them in turn, but I hope that gives you the flavour of what we're going to cover and how we're going to cover it against a sweep of dramatic change over the past year. We are going to do a live question and answer session at the end of the symposium, ladies and gentlemen. 3 of the speakers are going to join us. Unfortunately, Professor Pourel has a personal engagement and is unable to do so, but the other 3 will be with us. So if you have questions, please type them into the text question and answer facility as you go along, and we'll pick up as many as we possibly can in that live Q&A session at the end.